Assalamu alaikum. Hope you all are doing well. It is my pleasure to invite you to this live session arranged by DMCDC, and you have your host Ummea Habiba Willsy from K76 batch. Before starting the program, I would like to pay respect to all the frontline fighters who are working for our safety. Today's topic of this live session is heart, and we have our honorable guest who is the soul of the anatomy of DMC, the person who is a comparison to himself, who slays with the aura of the confidence, who is striving to spread his knowledge among us, none other than our most beloved sir, Dr. Shakil Shams Sir. Let us welcome sir among us.
Hello, my dear students. Assalamu alaikum. Hope you are doing well. Am I on this? I am live now? Okay, fine. So, you have heard that we will be discussing about the heart and the pericardium. And first of all, I would like to thank the Debating Club of Dhaka Medical College, DMCDC, for arranging such a program. So, today, as you have heard, we'll be discussing about the heart and the pericardium, right? So let's pump. What is pump? Can anyone? Pump means playing with the words, right? So let us play with the words. Thorax, thorax, or a little bit of unknown things, right? Next, come another Twitter or transformation of the word heart or heart. What do you mean by this? This is the Cupid, and his bow, when passes through any heart, he or she falls in love. But sometimes it is a mishap, and then it becomes this heart, not this heart, right? Let's go to the history of these symbols and why the heart has been selected. The symbol has been selected like that. We can trace back the history. 400 BC, before the Christ, the silphium, the pods of the silphium plant, which was used for contraception, was being accepted as the symbol of love. Again, another thought is that this is the ivy leaf, which also resembles the same shape, which is for fertility, has been accepted as the symbol of love. Whatever, these two matches together, and there is this symbol now is the well accepted universal symbol of love, that is the heart in this form. But I tell you, heart is never ever like this. It is this chunk of meat, right? This is very chunk of meat or muscle, so as to say. There is nothing to relate with the love, but still we consider it. Why? Because when someone falls in love, heart beats pound out of chest. So it sometimes the liver doesn't feel like that, the stomach doesn't feel like that. That might be the reason. But thing is that we have to consider the heart in anatomical form right now. So let us be serious now. What if I tell you that the heart was initially in front of our mouth, just like here in front of our mouth, and if there were no membrane in this oral cavity, then we could swallow our own heart. Do you believe it? Can you believe it? Let's see a video now. And I'll explain this video by pausing it a few times, but you'll have a good continuous view of this. Let's see the folding of the sagittal plane of the embryo. Here you can see this is a week 3 embryo. This is the heart. This is the heart, as you can see. And now let's pause it. And this would be the future brain, and this would be the future gut, umbilical, vesicle, gut. You have not gone yet that much, so you'll not understand. Just see the video. The heart was in front. This was the mouth, supposed to be the mouth region, and this is the heart. So you can see the heart was in front of the mouth even before the brain. But what happens? Just see, you'll not understand, I know, but just go through this. Neural fold, that means from here the brain will develop. And see what happens. There is going inside the cavity. and there is enfolding again, more and more enfolding. Now you see the brain is coming front, the chest, the heart is going inside, and the GI tract is taking its position. It will go inside still further, and we'll close it by this, and we'll have a complete baby like this. See the changes. Okay, so now you can understand heart was supposed to be in front of our mouth, but that is not the position right now. That is actually inside. Where heart is, where now you can see heart is location of the heart. Can you tell me where is the location of the heart? You have studied it, so I know you know it. It is in the thorax. Thorax, in between the
Thorax.
right, in between the two lungs.
Mediastinum.
Right, and particularly to say we have divided in the middle mediastinum. Very good. So it is in the middle mediastinum. Right. So let's see it in another view. Like this. This is the middle mediastinum. This is the anterior mediastinum. This is the middle mediastinum, and this is the posterior mediastinum, and this is the superior mediastinum. And altogether, this anterior and inferior posterior are called inferior mediastinum. You know it, right? So heart is located in between two lungs. But always I stress on, you know that I always stress on viewing the live pictures or videos. Why? Because it gives much more information than these diagrammatic information. Yes, of course, these diagrammatic informations are very important to know. But if you want to have a good view of the heart and everything, you must go through the details of these kind of pictures, not only these diagrammatic ones. Okay, this is my earnest request to you that you just don't go through the Visramsing or those which are very much diagrammatic. Rather, go through some atlases. Please go through some atlas or some videos that will help you to build up the heart or the picture of these organs as such as it is in our body. We will never ever get a patient having this kind of heart, right? We'll have this kind of heart. So let us be acquainted with these sort of pictures and follow these details. Okay, let us come to the point where we were. This is the sac. Actually, heart is not in empty space. Rather, it is enclosed by a sac. So as to say, it is enclosed by a sac that is called pericardium. You know the term. And this pericardium is actually has got two layers. One is fibrous pericardium, this green one, which is very tough to yield, and it is attached to the great vessels, blends with the great vessels, roots of the great vessels, and inside there is another one which is called uh, which is called the serous pericardium. And serous pericardium has got two layers: parietal layer, which is intimately blended with the fibrous pericardium, and the visceral layer, which actually covers the second layer. If we consider how many layers are there in the heart, there are three layers: epicardium, myocardium, and endocardium. This is the endocardium. But from a little while ago, I told this is visceral layer of the serous pericardium, and now I'm telling it is the epicardium. So it's might be the same thing. Yes, of course it is the same thing. Sometimes students make the mistake when we ask what is epicardium, they fail to answer. But it's very simple. Its very simple answer is that the visceral layer of the serous pericardium is also called epicardium. It is the outermost layer of the heart. Then the middle layer is the myocardium, and this blackish one is the endocardium, which is a thin layer of simple squamous epithelium. Right. So this is the endocardium, thin layer of the simple squamous epithelium, and that is also continuous in the vessels, blood vessels. Right. Okay, let us have the Ajan be done. Shall we pause? Okay, let's pause for because the Ajan is we okay. Okay. See, if we remove this pericardium, actually the heart looks like this. Before that, it was covered, and in between, this is the pleura, this is the mediastinal pleura of the lung, and this is the pericardium, and beneath the pericardium, actually, when we remove it, cut it, and then we get the myocardial layer, and inside, here the whole heart is being removed. Okay, so let us come back to just see how layer by layer we can imagine and see the every details of the heart and every structure nearby, so that we can have a comparative idea regarding the location and structure of the things. Now, this pericardium, fibrous pericardium, as I've told you, it's not, it is very much tough thing, and it is blended with the roots of the blood vessels. But again, these serous pericardium has got a cavity inside. That is there. This is called potential space. What is mean the meaning of potential space? Potentiality means the ability to do something. He has a potential. He is a potential boy, or she is a potential girl. That means she has something in future, and she has the chance to do something in future, like that. So potential space are the spaces which can they are usually very much thin, very narrow, but if needed they can expand. That's why these are called potential spaces. These are true spaces, not a false space, true space, but they are very sleek in normally, but they can expand to a certain extent normally. So these, between the two layers, there is a layer of fluid which can accommodate up to 300 milliliter of fluid, pericardial, around this, and this actually lubricates and helps in easy movement of the heart during beats, or else would have felt pain, too much pain in every beat, would have felt pain. So this is the function of the two layers, and there is the fluid inside. Now let us concentrate on this serous pericardium, which has got two layers. As I have already told you, the parietal layer is intimately blended with the visceral layer, fibrous layer. So when we actually remove the fibrous pericardium along the with, we also remove the parietal layer of the serous pericardium. What we have is the visceral layer of the serous pericardium and the blood vessels in along with the heart itself. So now let us concentrate on the features. There are two features in this serous pericardium. Serous pericardium. One is called transverse sinus and one is called oblique sinus. Before that, let us finish up this part by saying about the serous, the two layers of the parietal and visceral layer. That these two layers, as you can see, they are continuous with each other. This is the visceral layer and this is the parietal layer, but they are continuous here. Here they are in two places. Actually, they are continuous with each other. One place is here where when they bound the aorta, ascending aorta, and the pulmonary triangle. That is the arterial end of the heart tube. You have not studied the heart anatomy, embryology of the heart, so you'll not understand. But I'll show you just a little bit of embryological aspects so that you can understand what we are saying, or else everything would be theoretical. See this one. Initially, this was the can you see it? Let's see it. Initially, it was like this. I always give the example of the balloon. I tell you that when I press my finger with the balloon, a balloon with my finger, the the point where it touches is the visceral layer, and the point which is away from it is the parietal layer. And out of that, in case of heart, it is fibrous one, right? So when heart is enlarging, and it is occupying the pericardial cavity, and finally it is assuming its anatomical position finally, and there is very little space. That's why it is called potential space. But you can see that these heart tube, this is called heart tube. This is called heart tube. I'm not going to the details of this. It has got an arterial end and a venous end, and is covered within the pericardial sac, and you'll see that it is not only enlarging, but it is also folding on itself, folding on itself, folding on itself, and finally it's becoming a very much complicated structure. It is no more a simple tube. It becoming folded and going, the upper part going below, anterior part going posteriorly. It will be dealt in due time, but have an idea that in this way, what happens that the arterial end is covered by the continuation of one tube of the serous and fibrous pericardium, and the venous end is for giving rise to the pulmonary veins, supravena cava, infravena cava. They are covered or enclosed or entered by another tube. So there are two tubes. One is from enclosing the arterial end and its derivatives, and the venous end is enclosed by another tube and its derivatives. And this venous one is inverse J-shaped. Inverse J-shaped. You can see this is J, inverse J-shaped, and in between this arterial and venous tube, there is a space that is called transverse pericardial sinus. This one, that is this here, this one, and this one is here, the transverse pericardial sinus. So you can see this is the arterial tube, and this is the venous tube, and in between this is the transverse pericardial sinus, where we can put our finger. I'll show you. And another one is a cul-de-sac, andhogoli, I mean blind-ended way. So you can insert your finger from below, but it will be blocked above, on left, on right, but it is free on below. That's why it is called cul-de-sac. So these are two sinuses. This is oblique sinus and this is transverse sinus. And these sinuses has got importance. Again, it is cut section seen from above, and you can see this is the transverse sinus and this is actually the oblique sinus. This is the oblique sinus behind the left atrium. So these sinuses actually allows the heart, particularly the atriums, to expand during diastole, right? And there is also another important function of this transverse sinus, that the surgeons put sutures to hold up, do surgeries during cardiac surgeries. They put sutures and do maneuvers by putting the sutures here. So this is a clinical importance for the pulmonary, transverse pericardial sinus or transverse sinus. But in general, these sinuses are very important for the dilatation of the atrium. So in short, this is about the pericardium, and I've already taken 25 minutes for that. So I'm not going to discuss about the arterial supply, venous drainage, and nerve supply of the pericardium. You'll study it yourself, and let us come to the heart itself. That was, I'm telling you, it can be passed, a finger can be passed through. Now, this is the heart. As we have seen, this is the heart. Same thing is here. This is the heart. Same thing is here. But can you see the difference? Let me concentrate, repeat it again. These informations are very important, but this will never create the impression like these figures. This is taken from Lippincott, Williams, and Atlas of Anatomy, Lippincott Anatomy. It is available online, and if you don't have, I will be providing it. But please go through this. See, this heart has got some presenting parts. This is the apex of the heart. This is the base of the heart. Sorry, this is the apex of the heart, and this is the most fixed part, the posteriorly. This is the base of the heart. So this is the apex, and this is the base, anatomical base, of course. And there are some few borders, right border from the opening of the supraventricular cava to the infravena cava. Then the inferior border or acute border, which from the infravena cava to the apex, and the left border is from the left auricle to the apex. Same thing here. I'm not going to repeat it, but it is the same. And there are three surfaces. One is sternocostal surface, one is inferior surface, and the posterior surface is called the base. So, you know these things. I'm not going to the details of these. Just one thing more, that this is an right and anterior interventricular groove That is, this is between the right ventricle and left ventricle. So that's why it is called anterior, because it is placed anteriorly. Same thing you'll get. This is here the posterior interventricular groove, and this is the coronary sinus, sulcus. That is the atrioventricular between the ventricles and the atrium. So this is the right atrium, right ventricle. This is the left atrium, but we are saying only the left auricle of it and the left ventricle. So this is between the ventricle. This one, the coronary sinus sulcus, is between the atrium and ventricle. And there are also interatrial septum. So these are the things which are the anatomical demarcation points, and we must know which part is formed by which, say for example, apex is solely formed by the left ventricle. The right border is solely formed by right atrium, and the sternocostal surface is formed by four sources. The base is formed by two sources. The inferior surface is formed by two sources. In this way, you must know which one is formed by which. This is very pet question of the teachers, and it is actually very important to know as well. And this one is this view. Same thing here. You can see this is the coronary sinus located in the coronary sulcus. This is the coronary sulcus. That means atrioventricular sulcus, and this is the posterior interventricular groove. This same thing here. So I'm not going to detail it, but you can see that these are the, what are these things? Left pair of pulmonary veins. This is the right pair of pulmonary veins, and right pulmonary artery, left pulmonary artery, same right pulmonary artery, left pulmonary artery, and these are the measures: the supravena cava, and the pulmonary trunk, and this is the ascending aorta. So same thing here, but impression is different. Now you know it. The right heart, left heart, you know it. I hope you have studied it, and you must know, because right heart is actually dealing with the deoxygenated blood, and left heart is dealing with the oxygenated blood. So let us start. You know the circulation. So right pump, and it is going. All the blood is coming from the body to the right atrium. Then it is going to the right ventricle. Then it's passing through the pulmonary trunk. Then by these right and left pulmonary arteries, they go to the lung, where they take up the oxygen and release the carbon dioxide. And this oxygenated blood passes through the lung and reaches the left atrium, then to the left ventricle, then to the ascending aorta, passes through the whole of the body. This has been simplified, and they ultimately reach the tissue level, you know it, where they release the oxygen and take up the carbon dioxide, and then the cycle starts again. These carbon dioxide rich blood goes to the right atrium. In this way, it is continuing. So this is in short about the cardiac circulation. And this one, as it is very small, from right ventricle to the lung and then to the left atrium, this is called pulmonary circulation. And these from the left ventricle to the whole of the body up to the tissue level, and then back to the right atrium, this is called major circulation or systemic circulation. You know it. So this is very in short, but it is a must-know thing. If someone makes a mistake regarding this, at any stage here, it is a blunder. Okay. So this is in short about the external features and about the circulation of the heart, that is passing, and what function the heart mainly does. We have nothing to know. Now let us come to the interior of the heart, that how it works. Interior of the heart, if we want to learn interior of the heart, we must go to these figures. How it works, how does actually heart works, and what structures are present inside the heart. You might just think that heart is a very simple structure. No, it's not that simple. Rather, it is very much complicated one. And should I mention it here, or I can, as it is here, I just mention it. We have an idea that heart just pumps like this. We show that a pumping of the heart is like this. No, actually, pumps like this, twisting and rotating, and also see, it's not very simple one. Basal spiral, apical spiral. So these spirals are just when we clean up, remove water from our clothes, we just twist it. Similar way, heart is actually twisting. It's not simply pumping like this. Okay, so we have a wrong idea regarding this. This picture actually showing how the heart is actually pumping. It's not simple pumping like this. It's just twisting. Okay, let us come to the interior of the heart. This one is the similar one of this. You just match it with this one. You can see the heart. Interior of the right atrium. The right atrium is divided into two parts. You know it. The posterior smooth part or sinus venerum, and the anterior rough part or atrium proper, including the auricle, right auricle. Please don't miss the right auricle. Okay, so this is the right auricle, and this is the anterior rough part actually, and the posterior smooth part sinus venerum. Now, what are the things actually there are there in the sinus venerum? And what are some terms, you know, the crista terminalis, sulcus terminalis? These are the terms, many terms we get. So what is sulcus terminalis and crista terminalis? These two parts, I mean the rough part here and the smooth part is separated by inside by a muscle ridge, smooth muscle ridge, that is called crista terminalis, and outside is the circular terminus. Similar, the outer marking is called sulcus terminalis. In the interior is the crista terminalis, and outside is the sulcus terminalis, right? Which is separating the smooth part from the rough part. And now, what are these terms like? Sinus venerum, what are the openings in the smooth part? This is one opening, very major opening, superior vena cava opening, another is inferior vena cava opening, and the third one is very important, the opening of the coronary sinus. What is coronary sinus? I'm coming to that, but just have an idea that it is the major venous drainage of the heart. 60% of the venous blood is carried by this coronary sinus, and that drains into the right atrium through this opening. So we'll come to that later, but you have an idea there. And also there are some openings called veni cordis minimi. And sometimes students also make this mistake that they think these veni cordis minimi are only present in the right atrium. No, actually it's not. It is present in all the four chambers, but it is prominent and more frequently found in this right atrium, but not that it is not present in other, because in other chambers these are not shown, so students consider that these are not present in other chambers, but openings of the veni cordis minimi are present in all the four chambers, particularly in the right atrium. So how many openings we are getting in the smooth part? The opening of the superior vena cava again, the inferior vena cava, and the valve, I mean the coronary opening of the coronary sinus, and the openings of the veni cordis minimi. There are multiples, right? Now, some of the information requires special mentioning, like muscular pectinity and crista terminalis. I've told you. This is the muscular ridge which separates the smooth part from the rough part, and from this some muscular impressions called muscular pectinity arises. Okay, and these crista terminalis, from these muscular pectinity arises, and these are parallel muscular ridges. Actually, these are parallel muscular. You can see they are parallel. They are very much parallel to each other, right? So, what is this is the rough part, and this is the smooth part. But what is the importance of the auricle? It is also part of the rough part. As you can see, it is also rough, not that much smooth. And one thing more, you must know the rough part, name of the rough part and smooth part of each of these chambers of the heart. I mean the right chamber, right atrium, left atrium, right ventricle, left ventricle. What are the rough parts of the right ventricle? What are the rough parts of the left ventricle? In this way, teachers sometimes ask the question. Now you match it with this. Why did we draw this? Actually, this has been cut from here and flapped outside like this. It was taken from here. This was here. Actually, it was cut from here and flapped outside, right? Flapped outside. So that we can see the rough part and the smooth part. And this is actually the anterior and this is the posterior part. And because we have removed it, it now has gone posterior, but it was actually anterior. Okay. In general, the function of the rough part is to slow down the flow of blood. And the smooth, in general, in all the four chambers, the function of the smooth part is to enhance the speed of the passage of the blood through that smooth part. So this is in general. So same thing is here. The rough part is dampening the speed of the blood, and smooth part is increasing the speed of the blood. Right. So this is the basic principle, and it applies to all the four chambers, wherever we get the rough part and smooth part. Now let us concentrate on some more details because these are very important to know. What are these things? Where are the pictures? Okay, this is not here, but you know the terms. Do you know the terms? The trabecular, the tendon of Todaro, then the triangle of Koch. These are the two terms: tendon of Todaro and triangle of Koch. Okay, if I get the time, I'll tell you, but I don't have that much time. Tendon of Todaro, triangle of Koch. Just let me tell you that atrioventricular node, the AV node, is located in the triangle of Koch, and the sinoatrial node is located just here at the upper part of the crista terminalis, near to the opening of the supraventricular. So this is the location of the sinoatrial node, and this is the tendon of triangle of Koch, which is bounded. Here it is the tendon of Todaro. It is not here. Above, below is the valve of the coronary sinus, or the opening of the coronary sinus, and anteriorly is the cusp of the right atrioventricular opening. This is the cusp. So this is the location where it is called triangle of Koch, and here it is the atrioventricular node location. Location of the atrioventricular node is here. So you must know these things. And one, I don't understand. I am afraid you will not understand. If any of it happens in pediatric wards. You know, when I was working in pediatric wards, it was my first intern period in pediatric ward, and the very senior, very expert RS, resident was there. He finally had to do an umbilical catheterization because no vein was available in that child, and we had to give an IV. We had to open an IV channel, but no vein was available. No vein we could avail. So he put his an through umbilicus. He has put a needle, and that ultimately reached here. Needle means flexible pipe, and ultimately it reached here, and blood was drained from the heart. It is very tough, very risky one, because if it touches the AV node, it will be causing arrhythmia. The heart will be running like anything, and the baby will die. But you can do it. If you have no other option, you have to do that. And the resident did it, and the baby survived. So it is very important that your anatomical knowledge must be sound. That day, if he didn't know the anatomy, he couldn't salvage the baby. So this is the importance of knowing things. Okay, you'll not understand it right at this moment, but have an idea that if I insert something through umbilical vein, it will eventually reach this, and if I can escape the atrioventricular node here, the baby would be surviving because there is a lifeline being established. Okay, this is out of that syllabus thing, but have an idea. Just have an idea. So this is and in the interatrial septum, between the right and left atrium, we find another one is called fossa ovalis and limbus fossa ovalis. What are these things? I'm not going to the details. This is depression in the interventricular interatrial septum, that is called fossa ovalis, and this is limbus fossa ovalis. It's embryological things, so I'm skipping it. Sorry, I'm running very fast, because time is running as well, and I think 1 hour is not enough to complete the heart. Okay, let's try and see how much we can cover up. This is in short about the interior of the right atrium. Why I wanted to mention these things, because I wanted to raise up the clinical thinking in you that heart is not just a organ of pumping. It is related with so many important things. And now let's come to the interior of the right ventricle. Right ventricle. It's a huge, massive structure, though the left one is even massive. And we can see if we have the left ventricle encroaches onto the right. So the right one is always crescentic and left one is circular. You know it. And the thickness of the left ventricle is 3 times more than the right ventricle. In this way, you use identify which one is right, which one is left. I'm not going to that because it is not just all this is theoretical. If we had a heart here, we could show, then it would have been beneficial. So I'm not going to that. But let us come to the interior of the right ventricle. Now, right ventricle has got again 2 tracts or 2 parts. One is inflow part or inflow tract, which is slow inflowing part or inflow ventricle proper. An inflowing part or the ventricle proper, outflowing smooth part, right? Outflowing smooth part or outflow tract, which is also called the infundibulum or conus arteriosus. So outflow, as I've told you, always the outflow or smooth part is for enhancing the speed. So what do we need? The blood is coming from right atrium to the right ventricle. If it rushes too fast, what will happen? It will break up and destroy all these internal structures. So these rushing of blood has to be stopped. So inflow is rough here. But when in the diastole, we need to pump the blood through the which one? Through the pulmonary trunk. So in that case, we have to have a very smooth part here, and that is called infundibulum. Right? So the principle applies everywhere because principles are principles. They don't change. Right? So this is the smooth part or infundibulum, and this is the rough part. And in let us concentrate on yet another thing. This is the cusps and valves. What are the valves that are present here? This is called tricuspid valve. Tricuspid valve. So the name implies there will be 3 cusps, right? Anterior cusps, septal cusps, and posterior cusps. And these valves are what? Actually, they are actually the reduplication of the endocardium sandwiched intervened in containing the lamina fibrosa. That means you have seen, all of you have eaten or have tasted sandwich. There are 2 breads inside, there is some stuffings. So similarly, the endocardium, say for example, this endocardium folds upon itself, and now there is a gap here. This is the endocardium. It has folded upon itself, and in between this gap, there is some fibrous tissue, and that becomes the cusp or valve. Right? And these valves are like in this, they are held together like this, so that they can only allow the direction of blood in one way, only one way direction. Say for example, blood can come from right atrium to the right ventricle. Never in normal state blood goes from right ventricle to the right atrium. If that happens, that is a disease condition. That is a morbid condition, right? So that is how it is possible, because cusps are held like this. They are opposing each other and they're hanging on each other. So, and see, this hung side is taken to the papillary muscle. I'll tell you what is papillary muscle, and by the coronary tendon. That is also that is what I will be also telling you. And so they are have a tension, maximum tension. When blood comes from atrium to ventricle, they just part apart, wide apart, and the blood goes from the right atrium to the right ventricle. But when the reverse thing is happening, the blood is being pressed during the diastole and it tries to go back. These opposed ones just may open up this much, that there, because there is trabecular and chorda tendini here, the chorda tendini are here, so it can't go all together out. So the blood can't go back because it is maximum. Say for example, in normal state it was opening to allow the blood from right atrium to right ventricle, but when it is going back, it is just like this, it closes, can't go further, and now the blood is pushed here again against this closed one, and the blood can't go back, can't go regurgitation happen. So this is the function of the valve. So these valvular complex, atrioventricular, right atrioventricular orifice, and the tricuspid valvular complex has got some parts. Students usually fail to forget to answer when we ask in the professional exams or other exams, what are the components of these valvular complex? The tricuspid valvular complex, they start with the valves, the three cusps, the chorda tendini, the peptide muscles, but they forget one thing about the orifice. Orifice is a very important part of the valvular complex. Say, for example, the valves are there, the chorda tendini are there, and the papillary muscles, and everything is there. But for some reason, the orifice has not been perforated. What will happen? Can the blood pass from right atrium to right ventricle? No. So the orifice itself, intact orifice, is also very important. The intact orifice is also very important. So what are the parts of the valvular complex? First of all, the atrioventricular orifice itself. Then the tricuspid valves, annulus. Tricuspid annulus means where I'll show you. This is the tricuspid annulus. This is the fibrous ring or tricuspid annulus where the valves are attached. Then the cusps, and then the chorda tendini and the papillary muscles. Right? So these are the components. So the orifice itself, the annulus, then the cusps, then the chorda tendini. These are fibrous structures, and the papillary muscles. So these all things forms the valvular complex of the right atrioventricular orifice, and there are anterior and posterior papillary muscles. Though there are three cusps, two papillary muscles are there, and this is about the valvular complex in very short, because we have to go further. And let me tell two more things: moderator band, another two things, moderator band and supraventricular crest. What are these two things? You have the idea. Moderator band, septum. So these things are actually called the trabecular. Trabecular means the rough part of the right ventricle has got three kind of things. The muscles are either in ridges or bridges or papillary muscles. Ridges means all through there is an elevation. ridge উঁচু জায়গা ridge তোমরা জানো ridge বলতে কি বোঝায় a fold, a raised fold, that is called ridge. Bridge, the two ends are fixed, but in middle there is block the river. Similar doesn't block, but ridges like dams, they block the flow. And papillary muscles are attached in one side, in the other side they are attached to free, and they are attached to the chorda tendini. So these are called papillary muscles. Three kinds of trabecular are there in the rough part. Again, then one of these ridges is very important. This is called supraventricular crest. The supraventricular crest actually separates the rough part from the smooth part of the right ventricle. So this is called supraventricular crest. There is a developmental background for how it is formed, but I can't go to that. And this is about the ridges. So it is an elevated structure all through. So this is called supraventricular crest. Then the bridge. Bridge is that. Then the important one is the septomarginal trabecula or moderator band. Septomarginal trabecula or moderator band. That is an elevated structure which is joint. You can see joint on two sides, and in between there is a gaps through which blood can pass. So this is called bridge. And this moderator band has got very important function. It allows permitted movement of the anterior. As you can see, it is attaching to the interventricular septum and also to the anteropapillary muscles. These anteropapillary muscle can't move very much without stretching it, or when it is stretched, it has to stop. So it is actually regulating the flow of the blood. At the same time, you have not gone through it, but we know there is a conducting system in the heart, and one part of the conduction, right bundle of his, I will be telling it in the next class if I get the chance. The moderator band comes through these and supplied to the rest of the right atrial ventricle. So this is called the moderator band because it moderates the flow and maintains the flow. That's why it is called moderator band or septomarginal trabecula. And third one are the papillary muscles. I have told you there are two papillary muscles, anterior and posterior papillary muscles, though there are three cusps. Papillary muscles are two. This is another mistake by the students, usually commonly done. They think that there are three cusps, so there must be three papillary muscles. No, there are two papillary muscles, anterior and posterior, though there are three cusps, anterior, posterior, and septal. So this is in short. I can't go a bit details, but you must know these things. And the interior of the left atrium and left ventricle is almost the same, so I'm not going to that. Left atrium, left ventricle is almost the same. But you can see here, there are two more valves. One is, these are called semilunar valve, pulmonary in the pulmonary orifice. Another one is the aortic orifice. These are semilunar valves, and these are the tricuspid valve, and the right one and the left one between the left atrium to the left ventricle. This is bicuspid valve, right? So bicuspid orifice. This is tricuspid orifice. This is pulmonary orifice, and this is aortic aortic orifice. And all these orifices are actually very much closely and fixed by a structure that is called fibrous skeleton of the heart. Fibrous skeleton of the heart. Have you heard this term, fibrous skeleton of the heart? Fibrous skeleton of the heart. That means, let me tell you one thing, that the heart is not continuous. The atrial muscles are not continuous with the ventricular muscles. Atrial muscles are not continuous with the ventricular muscles. Totally discontinuous. Only connection is through the conducting system. That is the conducting specialized muscles which carry the impulse. I have not gone to it, but just have an idea. So these are called the fibrous skeleton of the heart. Fibrous skeleton of the heart can be shown again here. You can see this is the fibrous skeleton of the heart. See, this is the fibrous skeleton of the heart. This is a figure of 8 shaped structure. Figure of 8, like the 8, figure of 8, figure 8. The structure, this is for the right or atrioventricular opening. This is for the left atrioventricular opening. This is for the pulmonary trunk, and this is for the superior vena cava. That they are all continuous, and the atrial muscle are completely separated from the ventricular muscles by this fibrous skeleton, and it looks like an 8. That's why it is called figure of 8 like structure, right? And this is the importance, anatomical importance, that they separate the atrial muscle from the ventricular muscles. And for these, there is always a delay. The atrium contracts first, then contracts the ventricle, or else If they were contracting together, nothing could have happened. Atrium, where if the atrium pumps early, it can pump the blood to the ventricle. Then the ventricle pumps. That is called atrioventricular delay. You have studied in physiology. The reason for it, I will tell it later. But have the idea that with this delay, we can actually have an effective pumping of the heart. But for the surgeon, it is a blessing because they stitch or suture their materials when they do the surgeries on the valves. They suture their materials, the needles here, and they take hold of the valves, or else they couldn't have done the surgeries. So these blessings for the cardiac surgeons when they do the surgery, but it is also blessing for us because it is separating the atrial muscles from the ventricular muscles, right? So where we had been, so let us come back to the point. Just I have told you because this is of the heart. I have told you already. What is the structure of the heart? Epicardium or the fibrous pericardium. Sorry, the visceral layer of the serous pericardium, then the myocardium, and then the endocardium. Endocardium, as I've told you, this is simple squamous epithelium. And what about the myocardium? Myocardium, actually, there are four kinds of muscles. Four kinds of muscles. Nodal, cardiac muscles. Nodal, transitional, working myocyte, and Purkinje. Though the pronunciation is Purkinje, we are used to say Purkinje. In Bangladesh, we are used to tell Purkinje, but the actual pronunciation is Purkinje, like Hansi Kronie. They don't say Hansi Kronsi, the great and ill-fated player of South Africa, the captain of South African cricket team, Hansi Kronsi. They don't say Hansi Kronsi, but the pronunciation they say Hansi Kronie. Similarly, Purkinje. But in Bangladesh, we say Purkinje. Anyway, but whatever, you must know there are four kinds of muscle fibers: nodal, transitional, working, and Purkinje myocytes. Nodal. This is something related to the synovial node, and these are plenty in the synovial and ventricular node. They are very much, rhythmicity is more, but conduction velocity is less. Transitional also, rhythmicity is more, but less than the nodal, and the conduction velocity is less. Then the third is working myocytes. These are virtually these muscles are working. The contraction of the ventricles and the atrium occurs due to this presence of the working myocytes. And the Purkinje myocytes, the Purkinje fibers, actually what they do, they have the least of the rhythmicity, but most fastest conducting velocity. That's why they spread out the impulse throughout the heart. So there are four kinds of muscles, and with these, I think the time is ended up. Abrar, hello. Where will you? Should we conclude the class or continue? Hello.
Sir, you can continue if you want, sir, or if you can also end, sir. No problem.
Sorry.
Sir, you can continue if you want, or you can also end, sir, if you wish. Sir, no problem.
Actually, it is actually, you know it. Heart is not possible to finish up by 1 hour, right? So, is it possible for you to give another session later?
Sir, we would be very much pleased and happy, sir, if we could arrange another session with you, sir. That would be awesome, sir.
Okay, fine, thank you. In that case, I want to conclude because I'm nowhere to stop when I continue anymore. Right? Well, was it okay that I had to hurry because 1 hour is not enough, you know. Just to mention the things. Uh, okay. So there are so many things, important things like 1 hour is not enough, you know. Just to mention the things. Uh, so there are so many things, important things like.
Thank you so much, sir. It was an extreme delight to have your valuable time among us. Thank you so much, sir. Hope
Okay. Okay. Thank you once again, all those students who were here, and you, those who have arranged. Thank you once again, and I would be very happy. I'll feel happy if I can continue it and complete it. Okay, thank you. Should should I now, or you?
thank you thank you everyone for your patience. If you got any more queries, please inform us in the comment section. Our seniors will help you. May Allah bless you all. Thank you. Allah Hafiz.